Welcome, everybody, to the NoShameOBGYN Podcast. I'm Dan.
I'm Fran.
And today's episode is going to be about love and bugs.
Love and bugs.
What the hell is love and bugs?
STDs, Dan.
I love
The
STDs.
good old...
It is my favorite visit in the office.
Really?
Yeah,
Your favorite?
My favorite.
Of all of them.
Because you get to learn so much about what happened.
Okay.
Hopefully they make it to the office, which I think sometimes is the hard part.
Yeah.
But if they make it to the office, then the discussion is my favorite.
Okay. But STDs, like, why are we still so weird about this? Like, I find that even I could talk to my most vulgar friend about all of her extracurricular activities, but the minute we talk about STD screening and discussions, like, everyone clams up, if you excuse the pun.
They do. I honestly have no idea as to why, and I think the hard stuff, and especially is coming in the first place. And when they do come in, and maybe they're more willing to even have that conversation, but once you're in the private setting, maybe you're just like, I don't want to talk about this for whatever reason. I don't know what's so weird. It's a bacteria most of the time, right? Sometimes it's not, but that's not your problem. That's for us to kind of help and figure out. And it's not like you're screwed.
That already happened.
That might have already happened. That probably already happened. It doesn't come off a toilet seat, right? Which is whatever. We'll figure that out. But I think it's an important discussion to have, right? Because it is a fixable thing, especially with the most common ones, and having a stigmatism about having it being in a difficult time or way to discuss those things is ridiculous. Yeah. It really is.
So, like, all right. I am your patient. I
Cool.
come to your office and
Cool.
I secretly want to get tested for STDs because I have a new partner, but I don't really know what to say because I don't want to tell you. I just want to be like, oh, I'm here for my annual.
Okay.
Are you going to bring it up to me, or like, how does that work?
Absolutely.
Okay.
Anyone that steps into my office, especially because you're pretending you're a 21-year-old girl coming home from college.
Or I could be a 35-year-old divorcee who's about to get out and throw the cat around town because I earned it.
Or you're a 35-year-old married woman and love your husband. I can care less.
That's true.
So the discussion, let's say regular annual visit, we'll discuss at another time. But no matter what, I'm saying, hey, we're doing your pap smear today, right? And do you have to do that one every year? No. But let's just say we're doing a pap smear this year and you're sexually active at least once in the past year, for all I care. I'd be like, hey, do you want to get STD testing? That would be like just my first question. And at that point, it's more of like a vibe. Like, how do you respond to that question? Mm-hmm. I just want to gauge where you're at.
Yeah. So I will tell you that when I was dating my husband, I would get it every year. And then we got married, I stopped because I said that I didn't want to go to jail. Because if I tested positive, I would be in prison for murder. However,
first degree planned. Planned.
You better stop talking because you are my alibi friend. But the truth is that that was a really silly way of me to think because a lot of these diseases are silent.
Correct.
Most of them are silent. And just because you're HPV positive now doesn't mean that you just got HPV,
Correct.
right? So these are people that have been married for years or dating for years. Suddenly they come to you, they finally agree to get a STD screening, stuff pops up, and now they're about to divorce their spouse or commit a,
Right, and it depends
felony.
on what it is, right? Like if it's gonorrhea, chlamydia, and that's the only person you've been with in the past couple of months.
No shame.
No shame.
No judgment.
But that's just what it is.
But it is what it is.
And it is what it is.
Yeah.
But if it's like HPV, for example, and I know you're all going to Google, TikTok, all that bullshit and figure out where it's coming from, HPV, you could have gotten it many, many years ago. And the older we all get, our immune system weakens and it might pop up on that pap smear. Also, up until the age of 30, you most likely will never have been tested for HPV in the first place.
You shouldn't be, actually. That is a really big deal. So many women, right, Dan, were getting unnecessary procedures
Correct.
on their cervixes for something that was resolving on its own. And we found that it made no sense to do these early
Correct.
pap smears with HPV screening.
There's settings in pap smears where we do send for an HPV,
Okay.
but only if there's an abnormal pap that pops up under the age of 30. But we'll get through pap smears at another time. I think I still love talking about the bugs.
The bugs. Okay. So, all right. So I come to you.
Yep.
You get me up in the stirrups. Now what? How do you actually test for these things?
I won't say that out loud. Get me up in the stirrups.
That's why I'm here.
I will respectfully ask you. Okay. So what are we doing? So if let's say you've agreed, right?
Yeah.
How do we test for all of them? So at least in our practice, or in my practice, but also what's recommended, if we're doing a PAP, off the PAP, you could check for gonorrhea, chlamydia, and trichomonas. Those are the most common ones that women do get. They can present in a myriad of different ways and can have very serious complications if you don't treat them. And I could tell you a story afterwards about like what I saw at one point. And then after the PAP is done, off the same swab, there's no extra swab. Then I say, hey, get dressed after we've had a full kind of discussion. And then one of my nurses would come in and do blood work, and that's where we check for hepatitis B, C, HIV. You know, a controversial topic actually is checking to see if you are herpes antibody positive.
I hear this all the time. A lot of places will still check your blood work for herpes, but then I heard from work that that's
useless.
Not appropriate.
It's also useless because the only thing that really matters is if you actually had an outbreak in the past. And that's kind of it. And your partner could lie to you about it. You know, that's just a fact, and that's still what happens. And if you see something, say something, meaning that if you're having sex and you see something there, don't touch it.
Don't put your mouth on it.
Or anything on it, respectfully.
But especially your eyeballs or your mouth.
Eyeballs, terrible idea. Don't get near. But that's the truth. So a lot of women test positive for it, and then they're like, so he did it. And I'm like, no, absolutely not. You could have been positive since you were like 5, because maybe grandma kissed you with a herpes lesion. You got sensitized to it.
Cold sores equals herpes, guys. Like, this is something that I'm so sick of explaining. A blister that comes from the herpes virus has herpes virus in it. That is a herpes.
It's just herpes.
It could be on your finger. It could be on your lip. It can be on your genital region. But the point is, like Dr. Dan's saying, that is still a herpes, and that's how you can transmit it, right?
It's just herpes.
Right.
And they check for like 1 and 2, but nowadays we're all doing crazy things. So 1 and 2 go up, go down, left and right, upside down, doesn't matter.
True.
Herpes is herpes.
Herpes is
It's not going to kill you, but it can make you miserable.
Yeah.
You know, like there's things like hepatitis and HIV that are very serious. I'm not going to talk about like what everything's serious, but you know, herpes you'll live with the whole of your life if you're symptomatic, but it won't kill you. But it can drive you up the wall. It absolutely can.
You want to know a crazy story? I had a patient once that I actually knew from like high school.
Right.
And like, nobody Google my age, it's none of your business. But
it's 18.
Exactly.
Barely legal.
Yep, just graduated. But I actually had a patient who was having elective C-section, and when I did her history, she asked me to do her C-section. So I went and did her history, and I said like, oh, why are we doing a C-section? It's your first kid. And she dead right to my face said, it's because when I was in high school, I had my first outbreak of herpes. It was horrid, and I don't want to even risk an asymptomatic shedding. I just want a C-section. And I was like aghast because number one, we were in high school together. I would have never known such business. Number two, the no shame, guys, like no shame to say like, I just had a disease. Right. My disease is in control, but I want to do X. Now, to be clear, you don't need a C-section necessarily if you don't have symptoms, but that's her choice, her autonomy. But my point is, like, I was so proud of her.
Shared that at 18?
I don't know. But like, I was so proud the way she just was like, to me, with no shame, no embarrassment. Like,
but would she have shared that with a guy at 18?
I don't know.
With a guy at 19, 20, 21, when they're just meeting at a bar or whatever it is?
I don't know. I don't know if I would share that now at 36. Like, at 22.
Whoa. Yeah. Well, I mean, so this comes to the story. Like, I actually had a good friend from med school, but he said his idea, and we could talk about how we prevent STDs as one of the discussions, right? Is every time, or I'm not gonna say he did a lot, but let's just say he met someone new and they were planning on having sex. If, let's say, she was on birth control or some kind of contraceptive method, you still get all the stuff. Gonorrhea, chlamydia still passes unless you use a condom. Right. It's not perfect, but using a condom is your best method of protection. Mm-hmm. But, you know.
The entire way. Like, the minute the pee-pee is out in your face, girls, like, the condom goes on. It does not even the tip, not for a second. That's not safe. That still counts.
Everything counts.
Everything counts.
Everything counts. So his idea was like, hey, I don't want to use a condom for whatever personal bullshit reasons.
It feels better.
Yeah, right, whatever. The boys will be boys. Stupidity, but whatever. But he actually, his parents were physicians, and he was like, listen, I want to have sex, right? Clearly, whatever. But he's like, here's my STD report from a month ago.
Oh, shit.
And he's like, I'm not doing it either if you give me your STD within the past month. And
that's like a big ask, though, don't you think?
honestly, after like maybe when I was 18, 19, I would have never thought about that. But I was also health class scared the shit out of me, to be honest. So I was scared of that, all that either way. But like, honestly, like stuff happens.
No, for sure.
Like people have serious complications with this, especially when they don't talk to their docs and like figure out, hey, let me get tested. Oh shit, I have it. Let me get treated. So here's another story, right? I had a girl that came in. I saw her in the office 4 days before I saw her in the emergency room. Okay, so let's just say this happened, right?
Okay.
Age, I think she was 22 or 23. I don't know, something like that, right? But whatever, sexually active.
Okay.
She comes into the emergency room, fevers, chills, and I'm like, okay, so and pelvic pain, you know, so we do an exam.
The trifecta.
Nothing on exam, except abdominal pain abdominally, but pelvic from down below, clean. Right. So then, keep in mind, 3 days ago in the office or for whatever I saw her, I sent off an STD for screening.
Okay.
Not for symptoms. She had a new partner. I sent her off for screening just to see what's going on.
Good for her.
I do a sonogram. She looks like there's a big cyst on the ovary, and she's in a lot of pain, and she's febrile. One of the things we're concerned about is ovarian torsion. And a young girl, young woman, anyone who still wants to get pregnant, you're like, this is an emergency. We got to go fix the ovary.
It's a surgical intervention.
Emergency. So we go to the OR, laparoscopic case. I get in there, and I see this large cyst. We start taking off the cyst. The cyst pops, which can happen most of the time.
Yeah.
And frank pus comes out.
Ew, poor girl.
Frank pus comes out, and her whole tube
is full of pus.
It's full of pus.
Shit.
She ends up with losing her tube.
Ah, damn.
There's no choice.
You have to.
It was all that. The ovary stays in, but the ovary we cleaned out, took out all the infection, whatever. I come out of the OR. I open her chart the next morning, like at 4 a.m. because this was a night case.
Of course.
Positive for chlamydia and mycoplasma.
Damn, girl. We're gonna pour one out for your tube, girl.
My alcohol sitting far away. Bullshit.
Amateur.
Right. So that look at that. So like 22, 23, she lost a tube, and that means you still can get pregnant. That's not an issue, but you're playing with fire in that sense.
Yeah.
So like I remember that case, and then she comes into the office and she's like, "Well, how'd it happen?" I mean,
we know
how it happened. Yeah. And she asked me straight up, which I think she's obviously been through enough that she's gonna just actually have that conversation.
Yeah.
But the point is, at least she got screening, and I know this situation it was kind of late.
Yeah.
Right. But you have a new partner. Let's say you don't ask them for the records or whatever it is. Like you might think that's aggressive. Like go see your GYN a month later. Like get tested. Who cares? Like it's a new partner, or you never see them again. Get tested. You get tested a month after you have sex, and then 6 months after you have sex to make sure that if there's anything that didn't grow initially and grew back later, you get tested.
Okay.
That's
so a month and 6. Okay.
Minimum.
Because this is a disease, like chlamydia is not a personality flaw. Like
no,
it's a bacteria.
Yeah.
Just like you get COVID, you get the flu, you get all this shit. What happens when you test positive?
For, let's say, chlamydia?
Anything that's a sexually transmitted. All right, let's start with chlamydia because that one I know the quick answer. But then let's say.
Why do you know that one?
Mind your HIPAA. Mind your business.
Okay, so you test positive for chlamydia, my 22-year-old patient, right? Like what happens next?
Yeah.
So I probably get the results back 2-3 days afterwards. And let's just say everything else is negative and you test positive. So we have that fun, awkward phone call. Doesn't have to be awkward. I make it fun, but you're probably pissed off because you're sitting in like college or.
Wait. Okay, let's pretend. Okay.
Okay.
Hello. Hi, Dan.
It's Dr. Kaitov. What's up? How are you?
I'm doing good. What's going on?
You have a minute to talk?
I do.
In private?
Yeah, I'm in private.
Okay, great. So I got your results back.
Cool.
And we've tested for everything basically, and you're sexually active. So one of the things you tested positive for is actually chlamydia. Yeah. What do you think about that? I do ask that question.
That's a great question because if I was picking up this phone, I think I would just start to cry because I would feel, based on just everything I've heard in my life, that I did something wrong.
Really?
Yeah, I think
I don't think a guy ever thinks that way.
A woman, I could tell you right now, I would feel like I did something wrong. Like I didn't follow the rules, I didn't play the game right, I didn't do the right things, and now I'm dirty, or that I like was like a Jezebel, you know. But this is why we're talking about this, because
absolutely.
That was my reflex, and that's something we need to stamp out because that's shit.
That's crazy.
That's literally that's like I just paused and was like, oh my God, I'm ashamed. That was literally the feeling I just got.
I don't know. My response would be, well, like, that guy could go fuck himself. That would have been my response initially.
That would have been my secondary.
I guess, but because it's happening to you.
Yeah.
Interesting. I never really thought about that.
No, I would immediately feel ashamed, which is not really why we're here, because the whole point is, why is it still awkward? Like,
correct.
It's a disease, just like if you got like Lyme disease, you're gonna blame the tick.
Right.
Yeah, you will, but like you're not gonna be ashamed about it. Like I like hiking. What can I tell you?
Right.
But now here we are, and now I have to.
And you gauge also to see how people respond, right? Mm-hmm. Some people pick up the phone, then they're like, "Fuck, I knew it," right?
Fuck, I knew it.
Right. Some people would be like just dead silence, and that's where I kind of have to interject. And some people have to interject, and because everyone takes information differently, you have to kind of assess, like, hey, talk. Like this, like you have to kind of give maybe information or be like, hey, what do you think? What are your thoughts? Do you know maybe who? You know, it's not time to play detective at that point.
Right.
You know, like that's not the point. She probably knows in most situations, maybe not all, but like most situations, she probably knows that this might be the only one, or she's had multiple partners and she doesn't know.
Right.
Which is fine. But the point is then like, okay, what's next?
Well, exactly. So what's next?
After you process.
What is like the legal, or I guess I'm not legal, like for me, again, I'm already dealing with feelings of shame, which I know we all know is not correct, but it's hard to like pull out a feeling that you want to like be honest to yourself and feel what you're feeling, right? So you might be a little ashamed, you might be sad, you might be angry, you might be like, whatever, F this, I don't care. But now we have to tell the partner, right? Like, what do we have to do about that?
So first, I tell you like, hey, this is what you need.
Okay.
And depending on medical conditions, there's different ways to treat it, but it's an antibiotic, let's just say. If you tested negative for everything, there's just one antibiotic, right? If you have certain medical conditions or you're very young, it depends on just whatever. You get an antibiotic. Long story short, who cares?
Okay.
I recommend, hey, you should call your partner or partners that you've been active, let's say in the past month, and be like, hey, yo, this has happened. Just so you know, go see your primary care. You know, I had this discussion actually with one of my partners today.
Do you not write like a...
Right. Do you write a script and give it to them and do it, right? So my opinion is like, yes, I can absolutely do that.
But how do you know they do it? How do you know they're treated?
I don't, but you do your due diligence. But also, I think that you should take the next step and be like, hey, you should go see your PCP and let them test you for everything.
True.
Right? And you might hate them in that moment, which is a whole other conversation. But maybe you do like them and they had no idea, because it doesn't mean that they were symptomatic in those moments.
Right.
And maybe they got to get tested for stuff that they didn't think they had to get tested for.
And I think for me right now is taking the feeling out of it. Like taking the stigma and the emotion out of it. Like you might like this person and now you feel like this destroys your relationship because I really like this guy and now he gave me a disease. The fuck?
But it's treatable.
Right, but even if it wasn't, let's say it was herpes and it's not, right? It's just the principle of like, it's not their fault. It's not your fault. There's no fault in...
Unless they knew?
Yes, but again, even so, like this is a disease. So they should be responsible to maintain their health status and like tell you, and then I can see you being angry and fault them. But my point is like, if they had no idea, they're asymptomatic, you're asymptomatic, and you got screened and came back positive, don't throw your relationship to the wind because you're like, this is their fault.
I think there's many situations, and I think that's what it is. And our job as just providers in general is just to like, one, it's hard to even get that information out of some people.
Yeah.
Just like
pry
share
them
it.
Open.
Like some people don't even want to tell me they're having sex. I'm like, and if it's me, like just go see someone else. I can care less.
Right.
The point is go find someone that you're comfortable with to even have that conversation.
My best friend who's gonna watch this, I see. Didn't tell me she was having sex until like we were 20 something years old. I literally drag it out of her. And even to this day, when her husband jokes about their extracurriculars, she turns purple. And I'm like, girl, you have a whole child. I know you have sex. Just stop it. Like, there are some people that just, they're private. I grew up way different, guys. Like, my upbringing has always been
New York.
New York. No. I grew up one of two girls that is from two girls who were from two girls who had two girls. Like, all our dinner topics was always like period, sex, and
my life was nowhere.
And so for me, this is all very organic to talk about this stuff, but that's why that's why we're doing this, right? We're here to talk about stuff that, like, I talk about at my dinner table, he talks about all day with patients, and we just want to make it so that you're like, all right, you know what? I feel like I'm in their living room talking to them about this, and there's no judgment, no shame. We're live, ladies and gentlemen. Okay.
So what are we doing, myths?
We're doing myths. We're doing rapid fire Mythbusters, where I ask Dan the myths that permeate the internet, and he's going to shoot them down. Or up, I guess, if they're true. Okay.
Okay.
Number one. If I don't have symptoms, I'm fine.
Bullshit.
Bullshit. Okay.
Yeah.
Only promiscuous people can get STDs.
More bullshit.
More bullshit.
More bullshit.
Condoms protect 100%.
No.
Okay.
They're amazing. They're great at if you use them consistently and obviously
Properly.
and also the partner uses them appropriately and throughout the whole time, as we spoke about. They are your best defense, other than like no sex, which is we all know it's not happening. But yeah, that's the best thing, but not 100%.
Okay.
Yeah.
If my pap is normal, I don't have HPV.
Lies. Many situations. That's a lot to go into.
So if I have a normal pap, I can still have HPV.
Does your PAP include HPV?
I don't know.
Right.
Okay.
Should include HPV.
Not always.
You even need a PAP.
Yes.
You always?
Not always.
I mean, a lot of stuff.
So many nuances, guys. But this is what you asked
But talk to them.
Exactly. Because they have the most up-to-date information.
Just have that discussion.
Yeah. You can tell if someone has herpes.
Just by looking at them?
Yeah.
Yeah.
Like, I can see you have herpes.
I do. No, there's no way to know.
No way to know. All right. Wow. Those were the big myths that were out there. What else? What do you think about?
You don't get chlamydia from a toilet seat.
You don't get chlamydia
My
from a
favorite
toilet seat.
one.
Or you don't get pregnant from a swimming pool.
It's like some people say, I went to the college party, bada boom, and I sat on the toilet there for like extra time. Like, no.
Yeah, that porta potty at the Renaissance Fair really did it to me.
You might get toxic shock syndrome from other stuff, but that chlamydia made its way in a different kind of way.
But yeah, I mean, I think we're still really awkward about this. Like, even this, we have those subconscious correlations between infections and dirtiness, and like, it sucks because, you know, even that joke I made earlier about like my husband, and if he tested positive, like, so what? You know, like, unless he was unfaithful, which is different, just because he has an STD or just because I have one doesn't mean anyone was unfaithful.
Yeah. I mean, I think the big one that pops up is HPV a lot.
Because that just randomly shows up on shit and
I
just
have
like
a lot of
throws things to the world.
45-year-old women that come in for like regular pap screening and whatnot, and then they test positive for HPV for the first time. They tested negative for like decades.
Yeah.
Right? And then they tested positive, and then they're like, he's cheating on me.
Right.
And I'm like, no.
Not necessarily.
Not necessarily.
Not
I mean,
necessarily.
I can't say no, but, you know,
not necessarily.
Not necessarily. Correct.
Talk to your partner.
We just do not know when you were exposed to it. And there's no way to check men. That's the thing about HPV, and HPV vaccines, why they're important for young girls, young boys, you know, because the guys are the schmucks at the end of this.
Here's a myth, actually, that I have heard many times. Does the HPV vaccine cause early ovarian failure? Do you know?
I also didn't even hear about this.
Oh, okay, so the answer's probably no. No, I recall hearing a myth when I was younger that don't get the HPV vaccine because it's gonna make you into premature ovarian failure. Yeah.
I've never heard about this. All I know is that it prevents women from getting cervical cancer in the future, and the guys are the schmucks that spread it, to be honest.
Yeah.
So therefore, boys and girls should get it.
Yeah. But the point is that
get tested.
Get tested. Exactly. Get tested. Go to your doctor. Say, you know, hey, I'm here.
But if you feel weird going to your doctor and saying that, like, look into yourself for one hot second, but maybe that doctor's not for you. Like there are a lot of us, and the thing is like these are sensitive topics, and you have to be comfortable just saying it.
Yeah.
Like, hey doc, I had sex. Great. I'm gonna be like, I'm gonna give, I give high fives. I'm like, great.
Good for you.
When did it happen? How many times? How many partners? That's how I'm gonna ask it. Unless you're sad about it, then I'm gonna be like, okay, when did it happen? Why'd you do it? You know what I mean? Like it just depends on how people like give and receive information. So, but the point is like just say it. And there's so many topics in women's health that we can say like, if you could just share it, but it's my responsibility to feed that out a little bit too. But it's a give and take. Yeah. We all need to be playing the right game to make sure that we can give you the best care, right? But also know how we can help you in the first place.
Now, like, what would you say to let's just say we get a really cool audience of like doctors, PAs, NPs, nurses. Okay. So what do you say to them when they tell patients about a positive result? Like, how would you, what advice would you give rather to those providers? Because I feel like
how to discuss them with patients?
Yeah, it'll reassure the patient. Like if I know my provider is gonna, handle this the right way and I feel like I'm comfortable talking to them and getting bad news, like I'm more comfortable going and seeing them. But if I'm like, oh, this person just checks my cholesterol, I don't want them to also check my STD panel. Like, how would you advise providers? I feel like you have a really good bedside manner.
So this is the thing. First of all, as an expert, I'm an OB-GYN, right? And to my own horn, I'm board certified.
He's board certified, people.
But I mean, like, at the end of the day, the one thing, as you know, with med students, you can't teach social skills. Like, I'm sorry. If you're going into this field, you need to understand that, first of all, you cannot be awkward. Especially as a guy in OB, like, forget, if you're awkward, don't do it. Like, it's just the truth. And you know the people we talk about and the people that we see. And of course, the most amazing part about it is that in OB-GYN, there's a massive shift of having more and more female providers, which I think is huge, right? I think there is room for men in OB, but obviously, like, majority of women feel more, feel more comfortable with other women, right? So therefore, like, that's one thing that we're doing, but social skills.
Yeah.
Like, even if you're a woman and you're just awkward and weird and you can't have that conversation, like, then you have to find someone else.
Yeah, you'd be good in, like, radiology.
Right. And
just
very important.
Just kidding.
Important.
Not messing with the radiologists out there.
And they save me a lot in a lot of settings. But again, it's just like, you can't teach social skills, and it's our also responsibility as, like, people in medicine that when we see these med students rotating through, residents rotating through,
PA students,
like we need to gauge their skill on having those tough conversations.
Yeah. Yep.
Because one day your daughter or son is going to go to a provider like that, and are they going to open up to them or not?
Yeah. I mean, I feel like really, if you're watching, like, listen to yourself, make sure that when you speak, like, we're sarcastic, we're talking to you, right? But when you talk to the patient and you're going to give that bad news to them, it's bad news, right? You have to be, neutral. Don't have any judgment in your voice, check your ego at the door. Also think about, like, I know a bias is unconscious, but, like, think about it. Like, I caught myself twice in this episode falling back into that, like, unconscious bias and being like, wait, no, that's silly. Like, this is just a disease,
Right, but also, like, there's also other situations, for example, I may know a bunch, but it doesn't mean I know it all.
True.
So I had people that were, unfortunately had poor circumstances, had unwanted sex. Let's just put it that way, right?
Ah, Jesus.
Right. But then I didn't have enough experience in my training to give PrEP or PEP or, like, all the things to, like, prevent HIV transfer.
Right. What he's saying is, like, the medications to prevent HIV is that PrEP and PEP.
Right, and they're giving it, like, post-exposure or pre-exposure prophylaxis. So I'm talking about post-exposure prophylaxis.
So if you've had any kind of sexual exposure and there might be a chance that this person has HIV because you don't know them.
And you never see them again.
And you're worried.
Everyone should have access to
correct
post-exposure prophylaxis. And in our, like, where we work, the infectious disease doctors are great in that.
Yeah.
So, like, I remember I had that one patient, I messaged them, and then they explained it to me. I'm like, oh, easy, got it. Okay, now I know how. But can I counsel someone effectively about their side effects of the medication? No, I'm not the best. That's not my patient's population majority stuff, but I know I have access to. So then if that patient comes through my door, I'm like, hey, listen, I know what I could do with the gonorrhea, chlamydia, all that stuff, but I think you should also talk to them as soon as possible from the time that you had sex, because you have a certain amount of days where this is most effective for the medication. And I think it's 5 from what I remember. You got to do, but they still, for that patient, they did it even 7 days later because they still said it's somewhat effective. I got them in the door to the infectious disease docs, and I told her straight up, like, listen, I know how to do this stuff, but I think you also need this stuff. And I don't care. Like, this is, like, I don't care that I don't know it all. You just need to know where to get that access to. And I think what I like about myself is that if I don't know something, I at least know who I could turn to so they could teach me and figure that out. And if your doctor has that, or any provider has that kind of ego, is like, oh, I know everything, it's just bullshit. There's so much. There's just so much stuff out there.
No.
I'm not an expert in.
Yeah. And I think our parting message for you folks:
Keep having sex.
keep having sex keeps us in business. But beyond that,
Just me and business.
I work for it too. But shame thrives in silence. Health thrives in information. So
Find a great provider. Make sure that you're open and honest about everything.
Yeah.
And if you don't feel comfortable, find someone else. There's definitely someone that's there for you, no matter what.
And as always, we will link our contact information in our bios. And if we are the only people that you're comfortable talking to right now, we are happy for it. And we will be your support while we navigate through all this shit.
And then maybe there's going to be another episode that is going to be like,
there will be so many episodes.
This also links to me too. So be on the lookout. First episode.
Yeah. Bye, y'all.